So let's talk about vitamin D deficiency. I think we all know this. In psychiatric symptoms, fatigue, insomnia, depression, you feel weak. So how do I go about that? Anytime at all that I may see a vitamin D level of 60 and below, I automatically treat it. Why? They'll tell you your vitamin D level is normal at 30. But like I said, if you're feeling like crap, you might as well try to bring that level up to the middle of the road. I was taught, treat the patients, not the labs. If the patient is feeling bad, don't deprive them of a potential cause for their depression, whether it's B vitamin deficiency or vitamin D deficiency. So the recommendation I give is usually 50,000 units a week. Why I do this? I have psych patients. They can't think. They can't even think about what is it they need to do that day. Let's make it easy for them. But it's easier to take one pill once a week versus an everyday thing. This molecule needs to be used at times. The reason being, no matter how much vitamin D I give someone, it's still low. The reason why, I believe it's because of the fact that the vitamin D receptor is not working right. There is a result where vitamin D is not absorbed right. At that time, you need to give K2. K2 activates the calcium binding actions of two protein matrix in the bone, the GLA protein and osteocalcin. So it makes the bone just as strong as if it was going to be with the vitamin D. This is Japanese study, people took K2. They had slower decrease in age-related bone mineral density. So the one thing I look for inflammatory markers is the CRP. Where can you find it? Anytime at all there is inflammation, arthritis, fibromyalgia. I tend to want to think that there are causes of fibromyalgia we just don't know about. So I don't like to tell my patients that, this is it, you got to live with it. I want to be able to find the source if I can, or at least try to get down the symptoms by decreasing the inflammation. Rheumatoid arthritis, viral infections, as well as toxin exposures, heavy metals, glyphosate, all those things can cause inflammation because the body is like thinking this is not normal in my body. So they're going to try to fight that with your immune system. How I treat it? In anti-inflammatories, glutathione, you boost your immune system. The CD and zinc combination, those are all good antioxidants to also fight the inflammation. If you have normal to high COMT, then I do like to also give the quercetin green tea, the berries, because they're full of antioxidants. They're good for you. But if you are low COMT, it may not be the best. Epstein-Barr virus, a lot of doctors don't think anything significant of this. But of course, whether it's like acute or chronic, it can wind up leading to chronic fatigue syndrome and myalgia. They feel bad and it can last for months. But what I wanted to share with everyone, the article in May 2021, brain behavior and immunity. Having mono in childhood or even adolescence gives you a 40% risk factor of depression. That's pretty scary. Is there a correlation between mono and depression? I say yes. And as we know, the new theory behind depression is inflammation. Inflammation brings down serotonin, brings down dopamine because of the cytokine reaction. So we got to work on taking away that inflammation for your brain to start finally working right. So what are the treatments for mono? It's mainly supportive, fluids, rest, good diet. But you can give antioxidants, glutathione I like, but you can also give N-acetylcysteine. That's also used to treat overdose in Tylenol, but it's a very, very good antioxidant. The combination of CD and zinc, you don't have to take all of them, but you got to take something in that realm. Quercetin is very good. It really does cut down the cytokine reaction, inflammation, as well as green tea. The anti-inflammatory effects of it is in the ECGC part of it. When we look at insulin resistance, there is a mental health impact. Let's talk about just the general population. 1/3 of adults have insulin resistance in the United States. So what? We have 300 million, like population. From last time I looked, 100 million have insulin resistance. But that's not even the main impact. Stanford study, September 2021. Insulin resistance doubles the risk of major depressive disorder. But that's not all. 40% of the patients with a mood disorder have insulin resistance. So they kind of go with each other, like one is affecting one and the other. So it's very important that we try to work on decreasing the insulin resistance in these patients. And how do we do that? Of course, we can talk about all the medications related to it, but as far as the purpose of this topic, we're talking about natural things. So chromium piconolate. It binds and activates an insulin receptor to promote insulin action. The study showed 1,000 micrograms a day is helpful to people who have lower insulin sensitivity. Didn't really help with, they had normal insulin sensitivity, but at least there's some data that I normally like to give these to my patients anyways, if they have insulin resistance. Anything I can do to decrease that risk, I would like to do it for my patients. Vitamin D is interesting. This article that I was going through is protective in insulin resistance by lowering inflammation. You lower inflammation, you decrease the risk of insulin resistance, because as we know, vitamin D is a good antioxidant. However, another article I did read also that I ain't put in here, that it does affect the beta cells in your pancreas to promote the release of insulin. So if you have problems with weight gain and insulin resistance, you better be checking their vitamin D level. What if they don't have enough? And that's why they're having a risk factor, or that's why they could be having insulin resistance. So we can talk about antidepressant supplements. As we know, L-methylfolate can be just as good to treat antidepressants. Tryptophan, as we know, that becomes the serotonin, and tryptophan becomes 5-HTP. St. John's worts, people ask me questions about that all the time, so I'm going to talk a little bit about that, as well as lithium orotate. How does that become an antidepressant? So I'm not going to talk about L-methylfolate anymore because I think we all know about that. So let's talk about the tryptophan to serotonin conversion. Tryptophan becomes 5-HTP, and 5-HTP becomes serotonin. So there is a difference between 5-HTP and tryptophan. The main difference is tryptophan causes a feedback mechanism that will also prevent the brain from making serotonin. It shuts it off. So you have such a thing called serotonin deficiency syndrome. I like to think of it this way. In mental health and psychiatry, feeling depressed is not about a Prozac deficiency. As you can see, it's because we're lacking serotonin. So people who have serotonin deficiency, they are depressed. They don't feel right. But if you get 5-HTP, it doesn't cause that feedback mechanism. So that's a healthier, safer way to more beneficial to the patient, especially if they are feeling bad and then they need more 5-HTP to promote the synthesis of serotonin. St. John's wort. In the beginning, I love this supplement, but then we saw that there were a lot of not so great things about it. But what are the good things? It's been shown to be effective than placebo, and it is good for mild to moderate depression. But my recommendation is short-term treatment. The reason being, because they have a lot of side effects, especially if you are also taking an SSRI. Serotonin syndrome has been documented, and it makes you sensitive to sunlight. And this is one of the reasons why I really don't like St. John's wort, because if I am going to give this to someone, I need to know they're not on all these things that can cause drug-drug interaction. Birth control pills, cyclosporine to give to people with transplant, to prevent rejection. Heart medication, digoxin, that's pretty dangerous if you increase that. because of what St. John's wort is doing to it. HIV medications makes it ineffective. Cancer medications, warfarin, as we know, that is a blood thinner. And mixing it with St. John's wort, you're going to have probably a high risk of bleed, as well as simvastatin, which is a statin. Also, there's a drug-drug interaction with that. So if you can rule out all these things in a patient, then they can have it if they really don't want to take anything else, because it is effective. It just has a lot of baggage that comes with it. Lithium orotate. Why lithium orotate is a good antidepressant? Well, let's think about this. Lithium deficiency is actually very common. We do need it in the body in small dosages. So one striking study that I ran into, this Japanese study showed when there's lithium in the water, in the community, there was a reduction in suicide rates versus communities that didn't have it. So a couple of things that can explain that. As we know, lithium orotate promotes brain healing by increasing BDNF. But it also decreases the dopamine effects. So it's also good for anxiety. And it inhibits dopamine as well as glutamate. And it promotes the GABA to be released. Side effects. At this low dose, I usually give around 5, 10, maybe 20, which is really nothing compared to what we normally give lithium, as a prescription. And I did the research, and lithium orotate side effects, all I kept coming up with is like lithium carbonate. So there's really not a lot of side effects. And the bad side effects are coming from therapeutic lithium, especially when it's like over the range of where it needs to be. But to be fair, it's not that I don't like lithium. Regular lithium, because that's the only thing sometimes a patient will respond to. Why? It could be because they have altered BDNF or any other thing, but you always have to worry about the renal effects with standard lithium. But when it comes to lithium orotate low dosages, that has not been shown to have an issue. These are the indications for lithium, traumatic brain injury. Even if they don't have altered BDNF, I think it's a good thing because you're just giving them the ability of increasing their brain plasticity. Low CompT, as we can see, it tampers dopamine effects and increases GABA. Mood instability, same thing, decreases dopamine, increases GABA. ADHD, it helps them increase GABA as well as tamper down the effects of the dopamine, especially with people with like low CompT. And that can also cause people to have ADHD. Supplements for anxieties, B vitamins, vitamin E. When you're stressed, the body uses more vitamin E. So replace it. Don't run out of gas when you're going through periods of stress. You're just going to get more anxious. Vitamin C, I thought this was interesting. It clears the body of cortisol, which is your stress hormone, right? Anxiety hormones. GABA. As we know, this is an inhibitory neurotransmitter, tampers down the effects of all the excitatory neurons, or at least counteracts some of those effects with like glutamate. Magnesium. Magnesium works because it decreases the hypothalamic adrenal cycle. And what happens is it decreases cortisol. L-theanine. Everybody else says give L-theanine. How does it cause a decrease in anxiety? It causes decrease in glutamate, or it competes for the glutamate receptor. So pushes the glutamate out, L-theanine comes in there, you don't have the anxiety anymore. Because if you know, glutamate is excitatory. Ashwagandha, this is an interesting supplement. They did studies, it's comparable to lorazepam. And guess what? It's not addictive. And same thing, it causes the decrease in cortisol. So melatonin is a sleep hormone for insomnia. The way to give it is 2 hours before you go into bed, because in normal physiology, that's what happens. 2 hours before going to bed, normal melatonin gets released in the brain. So it takes that long to get that effect of sedation. Usually 2 milligrams, the max is 10. Negative about it is that it can cause rebound if you give too much. So keep it low. But if it's not working, then you're gonna have to think about other things what's causing you to not sleep. Tryptophan. Why tryptophan is good for insomnia is because it becomes melatonin. The Journal of Psychiatry and Neuroscience says the recommended dose is 1 gram 45 minutes before bed. But of course, just remember, when you give too much tryptophan, it causes the feedback mechanism. So when you start to feel that way, you're gonna have to just like no more tryptophan. But these were the things that I researched and what natural supplements we can use to decrease insomnia, which is melatonin and tryptophan. Magnesium. Magnesium, you don't just tell the patient take magnesium because they have insomnia. You have to use threonate. The reason being is because this is the only magnesium that will cross the blood-brain barrier to cause sedation and to help them sleep. Okay, ADHD supplements. Since we talked about all the other supplements, what I'm doing now is just general things that I will give to patients, but knowing all the benefits of those supplements, why lithium erytate will work. Tyrosine, especially with patients at high COMT, you want to replace the dopamine the right way. I have patients who are actually not on any psychiatric medications or stimulants, but they're taking nothing but natural supplements to support their dopamine, and they're doing fine with their attention. Magnesium, we know that helps calm things down. Fish oil, when you have not enough cholesterol in the body, the brain is not healthy, you can have symptoms of ADHD. That's why you would give those things, or omegas. Probiotics. The whole idea is everything comes from the gut. If your gut is not healthy, that's going to the brain. So you need your gut healthy because that's what's feeding it. Zinc. Zinc is interesting because there's supposed to be a study in Michigan where there was way too much copper in the water. And the kids were having, high risk of ADHD. Zinc actually brings down the effects of copper. So zinc has more than just antioxidant effects. Zinc can also decrease that risk, but I don't check copper regularly, but I think it's better to just give than not to give if you think it's appropriate. Supplements for self-harm and suicidal ideation. You may not think that there are, but there are options out there. We need to focus on brain health. As mentioned earlier, the fish oil, the probiotics, antioxidants, but at times you may still want to give psychiatric medications, which, I'm not against. These are the good ones. Naltrexone that blocks the dopamine, beta blockers, alpha agonists.